Okay, I think then you can start now. So again, the webinar will be recorded. So if anybody missed the beginning, so I can share the link with everyone. So and also it'll be in our website. So if anybody missed the beginning, so we can just we send the link to them. But you are all set.
Great. Well, thank you everybody for coming today. I want to thank PSS once again for creating some wonderful programs. I'm not saying that because I'm one of the people who's speaking, though I do get the opportunity to speak with them or on their behalf quite often. And I appreciate everyone joining us today. And I hope you learned something, and that is that Medicaid's pretty generous, and some of those things are going to be changing in the next few months. So I want everyone to pay attention, because Medicaid planning is best done now, as in like tomorrow or today. So we'll go over that a bit more. Looking forward to speaking today. Hi, my name is Dan. This predates the coronavirus. I only have one chin here and my hair isn't gray. So this was before my reunion with my favorite breakfast cereals and my government sponsored quarantine. This is the disclaimer I'm required to put up. This is attorney advertising, I suppose. I'd like to think it's just information, but once you see it, you can't unsee it. So what are we talking about today? Well, today we are going to be talking about financial and personal steps for personal care needs of family members. How do you take care of family members? Personal care, health that's involved, personal care regarding caregiver issues. If you're not the family member who is sick, but you're the person who's providing care, what are issues you come across? Financial matters. How do we optimize your family's wealth so that you can make sure that everything that your older family members work for is protected? Or if you're that older family member, how are you going to protect that money from the government if it has the ability to care for you without costing you a penny? Properly transferring assets for Medicaid eligibility, and financial matters regarding long-term care policies. Last but not least, I'm going to be making some suggestions to you to protect your family wealth. I do want to say this. We're going to be covering a lot of territory. If you are not familiar with Zoom, I want you to go to your Zoom screen. That's the little green and red line at the bottom. If you go to that, you'll see a whole bunch of icons pop up. The one that's labeled Q&A is, surprise, surprise, question and answers. If you have questions, I want you to ask them, but I'll try to answer them at the end of today's program. So I'm sorry, it's just the way we're going to have to do it, because there's a lot of content today, and I promise I'll leave time. And if not, you can always touch base with me offline. So what are we talking about today? We're talking about helping people with their activities of daily living. This is the first of several buzz phrases I want you to remember. Remember that Medicaid benefits or long-term care benefits are based on your symptoms, not on the illness. So I've seen people with stage 4 cancer that have 3 months left to live. They don't necessarily qualify for Medicaid. But if you have someone with multiple sclerosis and they may have 30 years left to live, then the chances are they may qualify for Medicaid, because the different activities of daily living that are affected are what determines the type of care, whether or not you will receive it and whether or not the government will pay for it. The 6 activities of daily living are transferring, meaning walking, and I don't mean running, I mean walking around your apartment, bathing, dressing, eating, continence, and toileting. If you have problems with any of these activities of daily living, or your family member does, you may qualify for Medicaid or your long-term care insurance plan. Now, the issue is there are financial burdens here, and there's things that people have to be aware of when they're a family caregiver. And these are the challenges. First of all, to the caregiver, this is hard work. If you've ever had to take care of an older family member, you know it requires a lot of up, down, let me help you out of bed. It requires patience. It may require strength if you have a slightly bigger family member you're helping. This is humiliating if you're the person who's receiving the care. Whoever thought your child or your niece or nephew may have to help you go to the bathroom. It's not always so easy. You ask, can't I just pay someone cash to do all this work for my family member? Well, the answer is yes, but what do you mean personal care may not include cleaning and cooking? Well, that should be self-explanatory. I'll go over that. And then, of course, you saying, but I don't want mom to go to a nursing home. I don't want you to take mom to a nursing home unless she needs to be there. And the good news is the nursing home doesn't want her there either, unless she needs it. Now, here's some of the issues that requires hard work. And this is all backdrop to getting onto Medicaid. You know, if you're taking care of your spouse, they tend to be as old as you, unless, you know, you're fortunate or unfortunate enough to have married someone who's substantially older or younger than you. So the problem is you're having typically an older individual helping an older individual. And too often it tends to be older wife taking care of older husband, which, in the age of same-sex couples, that's kind of mitigated a bit. But, for more traditional couples of opposite sexes, it's not unusual for a wife to hurt herself because she's taking care of her husband. And by the way, I don't know how much wife wants her elderly husband helping her either. Parent to child, if you're taking care of a disabled child, there's definitely a time commitment. It hurts your career. It takes time out of your free time. And it really, more or less melds your ultimate estate plan because you're concerned about your child well beyond the point of you passing away. Child to parent care, there's sometimes an expectation of family care, or sometimes a parent says, I don't want your help. So this can be a problem. It can be humiliating, like we went over. And then last but not least, sibling to sibling. So if I'm the disabled child and then my brother finds out that my parents are going to die one day and he's going to have to be the one who takes care of me, he may or may not be so hot in doing that. And even worse, what if I don't have any siblings? What if it's going to be nieces or nephews? This is not always an easy decision to make. Who's going to care for me? Now, when you are providing care, the first thing you think is, whoa, I need a break. It takes you all of 30 seconds to say, whoa, I didn't know what I was getting into. I need to take a break. Now, it's not too hard for family caregivers to take time off. Not necessarily easy, but not as hard as it used to be. New York has the paid family leave law. Now, it's deducted from your salary, so it's part of the payments that come out of your paycheck. You get up to 10 weeks of paid leave for family members with serious health conditions. Well, what is serious health conditions? An organ replacement or the birth of an infant child or child care. So again, not always so easy, but believe it or not, it's easier than it was before. Now, you can receive up to 55% of your wages, capped at $746. I think that's actually gone up. I think this is 2019's figures, but you get the idea. It's in New York City, $800 a week. It's great, but it's not necessarily a heck of a lot of money. If you're here and live in the suburbs and you're in certain suburbs, that may even look like a lower number. But if all of these things are met, your employer cannot fire you. That only covers certain circumstances, though. It doesn't cover, hey, mom is sick, I'm going to take care of her for the rest of my life, and I expect my employer to continue paying me. It doesn't work like that. And I ask, can I get paid for the caregiving that I'm giving? Well, it all depends. It's not always easy to get paid, but there are some opportunities. If you have long-term care insurance policies, things that your parent or you, if you're the elderly individual, purchased with your money, it's an insurance policy. I don't want you to confirm long-term care insurance with managed long-term care. I will refer to that as MLTC just to make it a little easier. That is a part of the Medicaid apparatus that we'll be going over. And that apparatus of the MLTC governs certain programs like the CDPAP program and the PCS program. Just keep in mind that changes are coming October 1st. It's going to be harder to get on these programs and thus harder for family members to get paid under Medicaid for caring for you. And if you're going for traditional family Medicaid, sorry, most likely can't get paid. Now, we've said bye-bye to affordable care. It was more or less the beginning of last year, 2019. You used to be able to get away with paying for someone only 13 hours of salary to take care of your family member for 24 hours. Why? Well, you included in 8 hours of sleep time. What if your family member needed help during that 8 hours? That person had to get up. And then they also had 3 hours, the caregiver, where they were allowed to take time off for their meals. Well, let me tell you something. If your family member had to go to the bathroom or something else, that meal ended. Probably a good time to end that meal in the middle of it anyway. My point is this used to be affordable because you were more or less, quote unquote, exploiting people by only paying them 13 hours, but them being on call 24 hours a day. Well, that's gone. Now for 24-hour paid care, you have to pay them for 24 hours, and that includes overtime. So say bye-bye to the old regime. That's now almost long since gone. And then, of course, the family member that says, but I really don't want to go to the nursing home. Remember, the nursing home is only there to handle people who need to be at the nursing home. Fortunately, I don't need to go to a nursing home. And if your mother or your aunt doesn't need to go to a nursing home, they don't want her there either. Maybe if she's private paying, they do. But for Medicaid, no, they don't. And here's why. The nursing home's only getting paid about 50 to 75% as much from the government as they are getting from you personally. So if I go to a nursing home, I have to pay $18,000 to $24,000 a month. Let me repeat that. I have to pay $18,000 to $24,000 a month, whereas Medicaid pays approximately $12,000 a month to a nursing home. So the nursing home is left in this position. Do I accept people who are private paying, of which there aren't a ton of, but there are some, or do I want to get onto the Medicaid program and accept Medicaid payments for many more people? Well, they would like to have the best of both worlds. I'll take unlimited numbers of people who are private paying, even though they're limited, and any free beds I'll fill with someone who's on Medicaid. So the nursing home only wants you there if you're private pay and if there's something wrong with you. They don't really want your mother there unless she needs to be there. And then your parent says, or your aunt or uncle says, okay, I'm all better. Please get me the heck out of this nursing home. Do it immediately. Well, the nursing facility is going to want to see that their suggested amount of home care is going to be fulfilled, that you have found people to quote unquote deal with an exit or release plan. So they want to know that you have paid professionals waiting at home for your aunt before they're going to release her. Now, anyone who has mental competency and mental capacity can say, I am releasing myself voluntarily. I could care less what the doctors are saying. And they have the right to do that. Not always so easy, but they do have the right to do that. Just keep that in mind that, sometimes family members don't want to tell their other family members, hey, you could just get yourself out of here whenever you want. And remember, once you have a family member admitted to the nursing home, they can't be forced out. So that's the good news. So keep that in mind. Once you get them in there, you are on your way and they can't just be gotten rid of. Now, again, here's some things to keep in mind for personal care and preserving family wealth. Personal care and taking care of someone who needs activities of daily living monitored and frankly administered needs to be ready to pay money. Well, why do you come to a lawyer like me? To save money. My job is to try to save you money. After you see my bill, you may say, really? And I'll say, but really, it's actually not such a bad deal. Now, to qualify for Medicaid Homestead exemptions, meaning that you're preserving your family house by living with your parent for a few years and caring for them, is an important thing to remember is available to you. I'm going to go over homesteading, meaning being able to protect the family home, a little bit later. And just because you are a caregiver, like we said, doesn't mean you'll get paid. Yes, if you're paid from the care recipient, in other words, my mom says, Dan, take care of me, and she pays me every month, that's fine. Maybe from a long-term care program and maybe an MLTC program under the Medicaid program, but no if it's traditional Medicaid. And I want caregivers to remember this. You could take care of your dad for 20 years. Your mom may have passed away, your sister isn't helping, and you're the sucker who gets stuck taking care of dad for 20 years. Well, if he dies and he doesn't have a will, guess what? You and your sister are splitting his estate 50-50, even though you were the one taking care of him forever. Or the other thing is this, the person who's been the caregiver says, hey, wait a minute, dad changed the will, so I get everything, and that's fine. And then the family member who didn't give any care says, hey, I feel like I want to get some of this money. Well, if your dad changed the will in that case, they're stuck. They don't get anything. So it's important to remember that your parents or your family members you're caring for should change their legal documents to conceivably name the caregiver as the beneficiary. So if you're helping, make sure you have that discussion with your attorney as well as the family member you're caring for. And the question is, can't they just pay that nice neighbor next door to help out and pay her in cash? And the answer is yes, but remember, you are now risking employment law. And that means that you need to withhold taxes for Social Security and Medicare for the employed individual. Well, they're not technically employed, right? They're just an independent contractor. Well, the government beat you to that and they said, yeah, you think so, but they're not. You are now guilty of tax evasion. You're probably not going to be able to avoid that if you get caught. Also, you can't deduct any healthcare expenses you're paying on behalf of your family member. So if your family member is sick and they are paying money to a caregiver, you can get it deducted on their income tax return. But if you are paying in cash and taxes are not being withheld, it's not making it on that income tax return, so there's no deduction. So last but not least, remember this paid caregiver who's so nice, if they hurt themselves on the job, quote unquote, even if they're not working, and the chances are they're helping moving around your family members, so they could hurt themselves, they can sue you, not even just the parent, but conceivably the person who, quote unquote, hired them, their niece, nephew, child, etc. So paying cash to people who are actually affordable, yeah, the government beats you to that. So you can get away with it sometimes, but not all the time. Which brings us finally to the main course. So this has all been a long monologue reaching to the point of where we're finally getting to the main presentation with all of the actors involved. And who is the main actor here? It is Medicaid. Now, Medicaid is a healthcare and personal care program, meaning it helps people with activities of daily living needs that assists low income and asset families, I should say, in paying for long-term medical and custodial care, those activities of daily living. It's a joint program funded primarily by the federal government, and it's run at the state and county level, where different coverage, exemptions, and costs may vary. Well, that's a mouthful. What does that mean? Medicaid's a program that provides help with your activities of daily living, either in a nursing home or at home, and it pays for caregivers to help you with that care. Now, keep this in mind. So what is and what is not Medicaid? Well, now that I told you kind of what it is, at least from a theoretical standpoint, well, how does it help? And when does it pay and when does it not pay and what pays before it? So it's a government program that pays people who need help with their activities of daily living. Now, Medicaid is what we call the payer of last resort. Your family member, once they're 65, has to pay into Medicare. They pay Part B premiums out of their Social Security. Part B, just so you know, is things like doctor's visits and standard routines. Part A, and we don't really have time to get into Medicare, is for hospital stays, but they're paying for Part B, for doctor's visits, et cetera, out of Social Security right off the top. Well, you still got to pay Part B. Medicaid does not mean that you have to pay less than Medicare benefits off your Social Security. But do remember that Medicaid is not Medicare. Medicare is an entitlement program. You only get it if you paid into the system for 40 months, for 10 years, or a spouse did. And it pays for health care. Medicaid is not an entitlement program. You're just as entitled to Medicaid as you are entitled to ride on that F-16 fighter jet that's on an aircraft carrier that your tax dollars help paid for. You have no right. You paid for your Medicare. You never paid directly. You paid through standard income taxes, not through specific withholdings for Medicaid. So it is means tested, meaning you have to have a limited amount of assets and income to qualify. Here's a little hint. If you're destitute, you don't need an attorney to get onto Medicaid. You just go to Department of Social Services or Human Resource Administration, and you'll get on it instantly or relatively quickly. If you have money, that's when you work with people like me, so we can help you qualify. And remember, there are two types of Medicaid. There is home care, which we attorneys call community care. That's the care you get at home. A paid caregiver comes to your house, helps you do your activities of daily living. It has to do with some physical therapy. It includes clinical and outpatient, including what we call adult daycare. And anything that Medicare doesn't pay for physicians and pharmaceuticals, Medicaid picks up. That's great. Home care is preferable because you get to stay at home. Well, and then there's the nursing home, which attorneys call institutional care, because leave it to attorneys to think of the most horrifying concept and then make it sound 10 times worse. Institutional, you're being institutionalized. That's hospitals, medical facilities, and nursing homes. So if you're in a really bad condition and you can't continue to stay at home, which if you've seen someone who's really sick, they may not be able to stay at home, that is Medicaid institutional care. I want to make a caveat here. Almost all Medicaid programs provide none, meaning almost no Medicaid programs will cover assisted living facilities. So your family member who has a bit more money and may not be quite as bad off as nursing home worthy, but may not be in a great condition. Yeah, if they're trying to go to an assisted living facility, not covered by Medicaid in the vast majority of the time. Now, again, we talk about home care applicating in, home care application and eligibility. These are the income and asset levels your family member must meet. Remember, if you have a single family member, they are only allowed to $875 a month in income. The difference either goes to the government or goes to something called a pooled income trust. Assets, they're only allowed to have $15,750 in total assets. Not a lot of money, but there are exceptions. Let me go. No, we'll stick with that other slide. We'll get to the exceptions. Now, here's the issue. So if I have over $15,750 in assets, I got a problem because I don't qualify for Medicaid. Well, what if I have 16,000 bucks? Well, we can figure out what to do with 250 bucks. But the problem is, what happens when a family member has $100,000 or is substantially over $15,000? They have to gift their money to other people so that they can qualify for Medicaid. My mom, who's worked hard all of her life, now has $115,000, and now she gets a stroke or she has dementia. And she says, hey, I want to get onto Medicaid, Dan, and I want you to get it this excess $100,000. Well, there is a look back period. I want to explain what this means. If I am just staying at home, remember that care where we get to stay at home called community care because I stay in my community, she can gift me that $100,000 and I can get her qualified for home care Medicaid in 1 month. I want you to not look below that just yet. The nursing home is 5 years. So she gets on Medicaid, she gives me that $100,000, and 4 years later, she has another horrible stroke and now she has to go to a nursing home. She gifted me $100,000, but I didn't make it 5 years. She only made it 4 years. There's no partial credit. So in other words, my mother gifted me $100,000. She's invalidated for Medicaid. I had to get her to 5 years after that gift took place. We call that the look back period. And it's all or nothing. So she doesn't get credit for the 4 years. She had to make it the full 5. Now, look on the left-hand side again. For home care, she could transfer that money and 1 month later qualify for home care. So home care is preferable. Remember, you don't want to go to the nursing home. Your mom doesn't want to go to the nursing home, and your nursing home doesn't want your mom going to your nursing home. However, if she has to go after 5 years, okay, you make it 5 years, that's fine. At least she got Medicaid paid for her for home care for a few years. Look back at the left-hand column. Starting October 1st, what used to be 1 month look back for home care, my mom gives me the $100,000 excess dollars and she qualifies for Medicaid at home, now goes to 30 months. She gives me the $100,000 and she still doesn't qualify for Medicaid for the next 30 months. This is completely terrible if someone has a stroke because you can't really plan beforehand, right? So my feeling is that if you have an older family member who is sick right now or has a disease like dementia or Alzheimer's and it's still pretty early in the game, do your transfers before October 1st, because if they need Medicaid care, they're not going to have to wait 1 month anymore for home care. They're going to have to wait 2.5 years, 30 months. So again, like I said, you want to get Medicaid planning started, this is the time. You start today. Now, what kind of exemptions are available? If I'm over $15,750 in assets, I got some problems because I have too much money. Well, what if you have money in retirement plans like IRAs or 401ks? They're disregarded. Now, that's a good disregarded. Disregarded isn't like when you ask someone to go to the prom and they said, no, you were disregarded. It's disregarded for Medicaid purposes. That's great. So if I have that $100,000 in an IRA, I am covered for Medicaid benefits as long as I'm taking out minor distributions in the future. If I'm married, my spouse can say, I refuse to take care of Dan. Spousal refusal isn't when my wife says, do the dishes, and I say no, and then I have to sleep on the couch. Spousal refusal is saying, you can't ask me to force me to take care of my spouse for Medicaid purposes. You can still do that. I'm going to avoid talking about promissory notes. We will talk more about Medicaid trusts, and you can prepay your burial expenses. What if I have too much income? more than $875 a month. Well, I can use pooled income trusts and again, use spousal refusal. I refuse to take care of my spouse, not the dishes. Now, I want to bring this up as a matter of discussion. We like assets. We don't like income for Medicaid planning. And let's describe why. Well, assets are perhaps bad for retirement because you don't have anything guaranteed like a pension. You know, if I work for General Motors, I don't want to have a 401k plan. I want a pension that takes care of me the rest of my life. Well, that's fine as long as I'm healthy. However, assets, things like that 401k plan or cash we already have in the bank are good. We have complete control over them, meaning that we can spend them whenever we want. It's a bird in the hand is worth two in the bush. We can also trade or give our existing stuff to other people and change its nature. So I can give my money to my wife or to my kids or to a trust. And I can also change it from a checking account to a CD, to a mutual fund, to even Bitcoin. So assets are good, and they're good for Medicaid planning because they're what we have complete control over. What do I mean? Income, we don't really have control over. And what do I mean by that? Well, if I'm retired, I'm getting Social Security, or if I'm disabled, I'm getting Social Security disability. I may also be getting a pension. You know, if I'm a working individual, yeah, I get income and maybe I work harder and I can make more income. Well, if you're working, most likely you're not on Medicaid, right? Because Medicaid's trying to help you with a lot of these things that are very difficult to do. I do meet some people on Medicaid who are working beyond the scope of our discussion. You just don't have control over your income. It comes in. You can't say, I want more. Social Security Administration says, well, that's fine. This is all you're getting. You know, can't tell your former employer, give me a bigger pension. They'll say, that's what you're getting. You don't control income like you do assets. And you can only sometimes leave income to other people. I can give all my assets to my wife if I wanted. My income, yeah, I may be able to give that to my wife. My Social Security transfers to her when I die. But I can't give income to my kids or my best friend, and typically not my church. Just keep that in mind. Last but not least, Medicaid tends to punish high income earners. Why? Well, you are only allowed to make $875 of income a month. What if you have a pension or making $6,000 a month with Social Security? Over 5,000 of that isn't in your control. You can only have control of $875. Assets, I can give that to anybody. That's fine. I'm not being penalized. You knew deep down inside that the people who are, you know, the salt of the earth and getting these pensions, that they were going to get jerked over more by Medicaid. And that's the case. Last but not least, higher tax rates. Income tends to be the highest taxed other than estate taxes, and that requires a heck of a lot of money. If anyone here has $6 million or above, you can worry about New York State estate taxes. If you have $11.58 million, you can worry about federal estate taxes. If that's any of your problems, come meet me. We'll do lunch. I don't know how we'll do virtual lunch at this point, but I want money and you do too. But guess what? If you have an estate tax, that's a lot of money. Income tax, bad though. Now, here's the thing. Medicaid home care doesn't include cooking and cleaning. And the answer is it doesn't include so much cooking and cleaning. So you're worried about your Aunt Florence, who's going to be able to make her food? Well, the caregiver can heat up food. Don't expect her to make a 4-course meal with truffles on the side and, you know, she does a wine pairing with it. That's not what Medicaid's going to pay for. And it's not going to pay for her to get down on her hands and knees with the toothbrush and clean behind the toilet. The cooking and cleaning involved with Medicaid is relatively minimal. And deep down inside, you kind of knew that was going to be the case. Now, what does home care cover? When I have someone come to my Aunt Mildred's home to take care of her, it pays for a paid caregiver to assist with her activities of daily living. That was toileting, transferring, helping her feed herself, or walking from the bed to the living room. Now, here's the thing. There's no guarantee as to how many hours of paid care Medicaid's going to give you. So you could say, well, Aunt Mildred needs 24-hour care. And Medicaid could say, she looks like she needs 8 hours of care. Guess who wins in that argument? Most often, Medicaid does. But you can always appeal it. Good luck. Getting 24-hour care is very difficult, as you'll see. And again, there's no cleaning or fancy cooking. Warming up food is okay. Just keep that in mind. Now, you may be able to get some advanced cooking and cleaning services, which with managed care, which is the MLTC program. I'll go over that in just a moment. Now remember, a caregiver must be qualified individually or by a Medicaid compliant agency. So that paid caregiver across the street, you say, well, I want her to get onto Medicaid now and be paid by Medicaid. She would have to qualify individually. You do have to typically be someone here who has legitimate standing. So if you're a US citizen or you're a green card holder, not a problem. You can likely be qualified to become a Medicaid paid caregiver. But if you're somebody else, like someone who isn't here legally, et cetera, or not with a green card, you're going to have a lot of problems with that. Probably not going to get them to become qualified. And remember, everyone prefers home care to nursing home care. Aunt Mildred's going to say, please don't send me to a nursing home. I don't want to die there. I got you, Aunt Mildred. You'll excuse that traffic, by the way. You know, it's usually loud outside my office. Now, right now, if I were in my office, there's nobody in the neighborhood. Anyhow, it's hard to get 24-hour home care. So Medicaid may say too much care required. Aunt Mildred has to go to a nursing home. We're not going to pay for her home care. And that messes up everything. Now, we talked about homestead exemptions. That means protecting the family home. How do we protect the family home from Medicaid saying you owe us money, we're going to take it from you? Remember, you're only allowed to have $15,750 to your name. Not a heck of a lot of money. Well, there are some exceptions. First of all, tenants by the entirety. If you have a spouse who's a joint owner who's healthy, your home is protected. Congratulations. Same with the non-creditor spouse, meaning the spouse who's not receiving Medicaid, who is taking care of the sick spouse. Again, protects the home. If you're getting home care as opposed to nursing home care, you can protect your house if it's worth less than approximately $900,000. Yes, you can get home care and still the house will not have a lien placed against it when you die. That sounds great. You know, if you're in a McMansion worth $1 million, doesn't work because it's more than $900,000. If you go to a nursing home, that house is fair game. So just keep that in mind. If you get home care protected going to a nursing home, it's a lot of problems. You don't protect the house by going to a nursing home. You have to have it moved to a trust or to a family member well beforehand. Now, a child caregiver who's lived in the house with their parent for 2 or more years and taking care of them can avoid that house getting a Medicaid lien if the parent has to go to a nursing home. Now, if your child caregiver gets their mail at their house, but they file their income taxes where they really live in Seattle, and then they show all this income coming in from them going to California and Texas to do their job, you're probably not going to get the child caregiver exemption. Just keep that in mind. If mom and dad left you and your sister the home, you and your sibling who's a co-owner, if you've lived there together for 1 year, your sibling gets to keep the home. So this is good. It's saying basically parents gave the house. Now I've been living with my sibling who's been taking care of me. We're going to give your sibling that house, even though you go to the nursing home. The nursing home isn't going to be able to place a lien against that house. And anything that you give to a disabled child, including the house, is exempt from being taken over and having a lien placed against it by Medicaid. The government says you had bad luck. You were disabled at one point, and you also have a child who's disabled, and it has to be a child, not a niece or nephew. They say, okay, we're going to give you a break. We're not going to place a lien against the house for you going to the nursing home since your child is on Medicaid anyway and disabled. So homestead exemptions are great. Next, retirement plans, like I was saying, are exempt, meaning that you can have $1 billion in your IRA, and you may still qualify for Medicaid. You have to take distributions, it should be covered. And if you needed an impetus to save for retirement plans, as if you didn't have enough reasons, here's another one. You can qualify for Medicaid if you have money in retirement plans. Good, good, good. Save money in your retirement plans. I discussed a bit about spousal refusal. It says that your spouse may refuse to pay for your care and keep the difference. Here I have an old figure and the percentage is wrong. The consequence is if my spouse makes $6,000 a month, she's only allowed to make $3,216. She's technically supposed to give the remaining $2,800 to the government. She's making $6,000, she's entitled to less. It's not $3,090. I apologize, my figure is out of date. She has to then pay 25% of the excess in between that. So of the remaining $2,800, she pays $700 a month. And then she gets to keep the rest. So that's pretty good. Now they can place a lien, Department of Social Services can place a lien against the well spouse at their death, but who cares? You're on Medicaid. You couldn't have the assets anyway in most of the cases. Now, here's the thing, new Medicaid home care rules has a few things. What's kept intact? Remember how I said things are changing October 1st? Well, the first thing that's intact is we're keeping spousal refusal. That's great. So they can keep more income and they can keep more assets than $128,000. Your well spouse is allowed to keep not just up to $3,216 of income, $128,000 of assets, and then say, I want spousal refusal over any excess for both of those. We're keeping that. So that's good. New York says, we don't want to impoverish one spouse because the other one's disabled because now we have to deal with two spouses. So they're smart about that. Now remember, we have to also talk about the exemption of Medicaid trusts. Medicaid trusts must be irrevocable. What is a Medicaid trust? Well, it's a written legal document attorneys like me create that says, I'm putting my excess assets. I own this house worth more than $893,000. Or I have a brokerage account with $300,000. That's over $15,000. It's $750. I'm putting that into a Medicaid trust. This is a written legal document that I create with clients. And what the client does is they place their excess assets in there. Well, you have to do that because you have to look impoverished to qualify for Medicaid. That trust must be irrevocable. You get better, you change your mind, you say, I want the money back, you got a problem. Now, who are the parties to the trust? Well, you have three parties. You have a party that creates the trust. That tends to be mom and or dad who are getting older and they say, I want to save money for the kids. They create the trust and they change the deed and move the assets into the trust, the mom and dad Medicaid trust. Who's the trustee and what does the trustee do? Well, the trustee tends to be the children, and the trustee is the one who invests the property or the accounts, pays the taxes, files an income tax return. They're the responsible individuals. So you have the people who create the trust and give money to the trust called the creators. We have the trustee who administers to the trust. And then we have the beneficiary who just kind of sits back and enjoys the cool, hard cash. But it's Medicaid and there are attorneys involved, so you know it's going to be harder than that. Now, who does what with the Medicaid trusts? You tend to be, and by you I mean the elderly parent, if you are an elderly parent, create the trust. Someone other than you is the trustee. You usually name your kid. You can't name your spouse. I shouldn't say duh, because I know for a lot of people this is the first time you heard this, but you can't just give stuff to your spouse usually and get away with it. And last but not least, it tends to be someone other than you who's the beneficiary. Keep that in mind. Certain trusts, that's the case. Now we're talking about two different types of trusts in the next few moments. One of them is the one that you create, called an income-only trust. And there's one that is created by a not-for-profit that everybody chooses to work with. Because everyone works with them, we call it a pooled income trust. So the two different types, the income-only trust protects your assets. That's why I call them a Medicaid asset protection trust. Colloquially, they're referred to as income-only trust, but I call them Medicaid asset protection trust because they're protecting the asset. Who cares that you're entitled to the income? It's the asset we're trying to protect. And then there's the pooled income trusts. That's where your excess income goes into. Now, what is a Medicaid asset protection trust? It's a trust that protects the assets and only allows you to take out the income. So when I have a brokerage account, if I have $100,000 in stocks and it's generating $1,000 of income every year, if I create a My Medicaid trust to protect that $100,000, I can take the income, that $1,000 a year, but I can't take out the $100,000 for principal. It's a Medicaid asset protection trust. It protects the asset, not the income. And who usually uses them? It's usually older individuals who have some assets and they're willing to accept Medicaid level care. Keep in mind, if you're paying for care out of your pocket, it tends to be slightly higher quality than Medicaid care. I'm not going to beat on Medicaid institutions or organizations. Not just because that's what pays me, helping get people on Medicaid, but also because I have seen them give perfectly good care. But typically when you're privately paying, you get paid more. The Medicaid trust means you're just going to assume that you're going to get on Medicaid and the care may be good or not as good. And the special features are that the income, and only the income, is distributed. Been a little while since I've done a webinar. Distributed to the creator. The assets, the Medicaid Asset Protection Trust leaves the remaining trust funds, the assets, typically to the children. Best way to fund this trust is with a primary residence. Why? Well, you say, I can't take income out of this trust. Exactly. You're trying to protect the house. So you place the deed to the house in the name of the trust. You say, well, what happens if I want to stay there? You get to stay there. What if I want to move out? You can move out, your children sell the house, and they buy you a new house with funds in the trust. So the good news is also that you can continue to get the STAR exemption on your real estate taxes. A STAR exemption is basically a real estate tax deduction. You can still get it because you tend to leave the right to live there, called a life estate, in that Medicaid trust. This should not be confused with the second type of trust, the pooled income trust. Remember how I'm only allowed to have $875 a month in income when I'm on Medicaid? What if I have $1,875 a month? Well, I can leave that extra $1,000 to the government because I'm such a good guy and they're paying for my care, or I can place it into this trust, and it's called a pooled income trust. Now, you probably came to me to create that Medicaid asset trust we just spoke about. But then you say, well, I have this excess income. What do I do with that? You leave it to a trust that's created by a not-for-profit. And the not-for-profit pays your bills. So that extra $1,000 that would disqualify me from Medicaid, well, the good news is the pooled income trust company is going to pay my bills if I send them my bills. Now, keep this in mind. They're not going to give me cash. They're not going to gift money to other people because the whole idea is you're impoverished. You shouldn't be gifting money to other people if you're impoverished. So they're going to use the money just for you. And people say, hey, that sounds pretty good, right? All right, so I have to give them my excess income. They're paying the bills. What's the big deal? If you die and there's $30,000 left in that pooled income trust, you don't choose who gets that $30,000. It goes to the not-for-profit. You know, just because they're not-for-profit doesn't mean they're not permitted to take money. So that's how they make their money, leftover money in pooled income trusts, typically yours. Now, again, I tell people because of that, if you die, you can't leave the money to anybody. That I say, spend this money down before the money in that pooled trust, in the Medicaid asset trust. Spend the money down in the pooled income trust as every single month if you can. And then there's really not a great way to fund it. It's just your excess income. Remember, we're not really in much control of our excess income. So that extra $1,000 I make every month, over $875, I just give that to them. Oh, and one more thing just to bring up, you know, the Medicaid Asset Protection Trust, I have a choice of what I can invest it in. I can invest it in stocks, bonds, mutual funds, rental real estate, a business. I cannot do that with the pooled income trust. The only investment is cash because they're meant to keep it in cash because they're going to pay it out most of the time anyway. What are bad investments for Medicaid? It's basically anything that takes an asset and turns it into income. Remember? Assets, good. Income, bad. Well, non-qualified annuities, and I'm not a hater of annuities, but for Medicaid, they're awful. They're not good because any gain you make, all the gain is income taxable, and you have to take that first. So if I bought an annuity for $100,000, it's now worth $200,000, and I decide to take out 50 grand, the full $50,000 is income taxable. Because I made $100,000 until I take out $100,000, I don't get to take anything out tax-free. So annuities, bad. Took an asset and turned it into an income-generating machine. No good. What about permanent life insurance? Your college roommate found you 25 years later and says, hey, I sell insurance now. Buy this life insurance policy. It'll be around for the rest of your life. Sounds great. You put extra money in it every month. Now you get sick or hurt, but you're still going to live for several years because you have dementia or Alzheimer's or a stroke. Well, all that money you save in that life insurance policy is now going to kaput you because you can only have $1,500, not of death benefit, of cash value. So those permanent life insurance policies that you were told this is going to be good the rest of your life, Those are the ones that are going to blow you up because you can only have $1,500 of cash value to keep that policy going. The idea is we're trying to not allow this life insurance policy to be a place where you can shelter assets. Remember, assets good, want to transfer them. Well, here we're going to just transfer in a life insurance policy. No, you're not. You can only have $1,500 there. I'm going to avoid getting too much into Roth conversions. I don't think converting to a Roth IRA really makes much sense in most cases, certainly not for Medicaid. I'll explain why in some other webinar, not today. And like I said, anytime you turn a liquid asset into income. Ooh, I love the questions I'm getting. I haven't had a chance to look at them yet, but I promise I will look. I'm going to pull my Ted Cruz impersonation and take a quick sip of a beverage. Not that you could see. It wasn't nearly as awkward as when he did it. Now, what is Medicaid Managed Long-Term Care, MLTC? MLTC programs are programs that are Medicaid-compliant agencies that set you up with a certain dollar a month that you can spend every month. So they say, okay, the government's giving us, let's say, $4,000 a month of care for you. We get to keep our percentage. You have $350 or $3,500. You have $3,500 left for the rest of the month because we got paid. What do you want to spend it on? And that's where you can say, okay, I want this capitation, the $3,500 a month left over, to be spent on whatever the heck I want. What does that include? It includes things like more fancy cooking, better cleaning, paying family members. You know, most Medicaid programs pay non-family members to do all these things, and they just get paid an hourly wage, and that's it. But here, you're in control. That's why we call it managed long-term care, because you get to manage it with the help of a third-party program. And the two different sub-programs they created was the Consumer Directed Personal Assistance Program, CDPAP, because we love acronyms because it makes us sound great, and Personal Care Services, PCS. Well, I would have told you last year that these are great things to commit to memory because you want to get these things down cold, because this is where you get to pay the family member. Remember, your family member is probably helping you out sometimes anyway, so why not get them paid? Well, it used to be great because you could say, I'll pay every penny of the care that you're giving me, that whole $3,500 to my family. And they usually weren't allowed to get that much, but you could pay them. Well, here are the big changes that are taking place to manage long-term care, to the CDPAP and PCS program. Starting on October 1st, there's going to be a heightened standard to qualify under these programs. You're going to need to require physical maneuvering, and 3 or more activities of daily living are going to require help. So you have to be disabled, pretty disabled. Think. You have to be unable to transfer, unable to toilet, and unable to feed yourself. Or you have to be incontinent and be unable to feed yourself and be unable to bathe yourself. So those are 3 pretty, any one of those is tough enough. Now you have to suffer from 3 of these and have the need for physical maneuvering. They cut you a break. They say, all right, if you have Alzheimer's or dementia, you only require physical maneuvering and only 2. Well, in that case, my God, so you have to be pretty disabled. But what's the problem? If I'm too disabled, I'm going to the nursing home, right? So all of a sudden, it's pretty hard to qualify for these programs. And the plan for treatment is no longer determined by your doctor. It's by an independent doctor that Medicaid says, we want you to do this. So the doctor who knows and loves you and is a family friend for the last 30 years can't do that anymore. They can't be the ones who are telling you this is what you need. It's going to be someone you've never met before. And there's a new assessment tool that's being implemented slowly that says if you require more than 12 hours of managed long-term care, home care, they're going to require an additional, more or less, look over of what's going on. You're going to have to be, or your family member is going to have an additional person who says, yep, this sounds good, or nope, too bad, they're going to a nursing home. So look at what's happening. These great programs that used to pay out to your family members now requires you to be like in a very narrow range of being very disabled, but not so disabled that you need to go to a nursing So I think I spoke about the heightened standards. I'm not going to spend more time with this. I'll just let you take a screenshot of these screens if you want. I guess I'm saying this because when you have friends who say, yeah, I'm getting paid to take care of my family member, and you say, hey, I can't do that anymore because I only did this, you do it in like November of this year. That's the reason why the standards have gotten much harder. I'm going to skip long-term care insurance today because I think that most people have questions about Medicaid, and I'm just going to finish up with Medicaid. Long-term care is private insurance that you used to be able to get without too much trouble. They would pay out for your care as opposed to the government. There are different levels of care. Long-term care is great because it's private pay. It's actual cash as opposed to government programs. So it used to be wonderful to get long-term care until all of a sudden the insurance companies realized, hey, we're going broke from this because they were paying out so many benefits and it was so good for you that they said, we're losing money. We can't do this anymore. So best way to use long-term care programs used to be if you have long-term care, the moment you need it, transfer all your assets because then you transferred assets in time for Medicaid. That's good news. The bad news is that long-term care is hard to come by nowadays. Again, another discussion to take place about powers of attorney. Your family member needs a power of attorney that allows you to make financial decisions for them. Healthcare proxy. Your family member needs someone to act as their healthcare decision maker if they're unable to. If you have a power of attorney and a healthcare proxy for someone, you'll be able to transfer their assets and get them onto the Medicaid program because you can deal with their money and their healthcare decisions. If your family member does not have these, you're going to have what's called a guardianship if your family member can't make a healthcare or financial decision. Guardianships are terrible. It's not like a guardianship for a child. It's a guardianship where they're going to say, your mom or dad had mental capacity. We're about to take away their ability to make decisions. So we're going to get a whole bunch of attorneys involved. And guardianships cost thousands, even tens of thousands of dollars, sometimes even more. I like guardianships. And when Dan says he likes guardianships, you should not like guardianships because that means someone's getting paid a lot. And guess what? It's not you. So avoid guardianships. Have your family member sign a power of attorney to give you the ability to help them with their finances and healthcare proxies so you can help them make healthcare decisions so you can avoid a guardianship. You can get them on Medicaid. I'll avoid the living will discussion again. Would have loved to. Here are some suggestions for family wealth and maintaining it. Remember to invest in assets, not fixed income. You take your funds and annuitize it into annuity, you messed up for Medicaid purposes. I want you to transfer income out of irrevocable trusts. I want you to fund retirement plans or make sure your family member is and take advantage of those Homestead exemptions. Now, buying long-term care, good luck. I would have explained it a little more. It's kind of expensive nowadays. If you're over 60, you may that ship is just about to sail forever. So if you're 60, you may want to look at long-term care one last time. But you really need to get it sometime before that. Avoid converting your IRA to a Roth IRA, execute a power of attorney and a healthcare proxy. Went over the funding retirement plans and the Homestead exemption. Again, I have more on the home care rules. I want to answer your questions. A lot of these would have been great, but I'm going to say thank you. And I'm going to get right to the questions right now because I would love to answer it. Here we have someone. This is from Rosalind. I'm a caregiver on unemployment due to COVID, unpaid, starting on September 27th, and I continue to collect unemployment while on unpaid FMLA. Well, my answer is I'm not an employment law attorney, so I can't tell you the answer. I can tell you what Medicaid says they are paying if you're able to get paid on those programs, but I can't answer your employment law question. Sorry, that's just not what I do. If you have an irrevocable trust, can a nursing home or Medicaid take your house? Well, the answer to that is no, but you had to have placed the house in there 5 years before. Remember, a nursing home has a 5-year look back, meaning that you had to transfer the house into that trust at least 5 years before to avoid that being reclaimed. And that's from Alicia. Great question. If you have more questions, feel free to ask. From Anonymous, what if the primary residence, it's worth, I said it's a home worth $50,000, is in Puerto Rico, but due to the illness and lack of services in Puerto Rico, the senior came to New York. Remember, the Homestead exemption means this. It's real estate where you live. It's your home. $50,000 real estate that's in Puerto Rico, or even it's in Beverly Hills, it doesn't matter. $50,000 is not a primary residence and it's over that $15,750. In fact, I have, because I'm in New York, a bunch of people who have family members who have real estate in Puerto Rico that's invalidating them for Medicaid purposes. You got to sell that house. Get rid of that Puerto Rico property. I love Puerto Rico. My family has a place we used to go in Dorado. It's wonderful. Not so good for Medicaid planning if you're not living there. And if you live there, you're not doing New York Medicaid, you're doing Puerto Rico Medicaid. If you die and have pooled trust, let's see if I can, this is from Alicia. If you die and have a pooled trust, can you get the remaining money? How does the beneficiary get their money? Remember, pooled trust keeps all the remaining money. Anything that you are making that's too much income that invalidates you for Medicaid purposes, you don't get to keep that if it's going to the pooled trust. Any money that you have that's in excess that's keeping you from getting Medicaid benefits has to be placed either in a pooled trust or an asset protection trust. The pooled trust goes to the not-for-profit. I think we have another few minutes. Let me just answer a few more of these questions. Can you keep your $15,000 in assets? And if you apply before October, is there a look back? You know, if you transfer everything you own before October 1st, and then you don't even apply for Medicaid for another 10 years, or even if you apply the very next day, as long as you transfer the assets before October 1st, you qualify for that 1 month look back. Then we have also, what can the pool trust pay, and can you keep any of the $875? You keep the first $875. So that example where I had $1,875 of income a month, I gave $1,000 to the pooled income trust. The pooled income trust will pay for my bills that include rent, widescreen television, my utilities. If I want to buy tickets to go on vacation, they will pay for that. The things they will not pay for are cash, gifts to other people, alcohol, tobacco, or firearms or munition, and a few other things. I don't know. If I was on Medicaid, I don't know how much I should be trusted with munitions anyway. My point is this, that it's basically meant to be used for your care, but you can spend that $875 on booze and cigarettes and munitions if you want anyway. That $875 is yours. Everything else goes to the pool trust. Last few questions. Is the Medicaid evaluated criteria owned for CD, PAP, and PCS? The answer is no. That criteria applies to all programs. And can you end up with less care on Medicaid than you have on Medicare? My mom's entitled to 20 hours now a week. Thanks. Medicaid always pays more than Medicare does. Medicare only pays for a limited number of hours or days. If you go to a nursing home, Medicare will only cover the first 100 days. And if you don't get better after day 20, they can kick you off. Medicaid can never kick you off of Medicaid unless you have too many assets. It has nothing to do with your condition. Generally speaking, Medicaid can only help when it comes to those things. And then I have a thank you. You're welcome, Rosalind. And last but not least, can pooled trusts pay for clothing, paper? And the answer is yes and yes. That was from Susan. I would have loved to have answered more questions, but I spoke more than usual. I do like to hear myself talk as well, so I do apologize for that, but I was born that way. But I appreciate you having joined us today. If you have any questions, feel free to ask. Watch the presentation again and keep your eyes out. And last but not least, if you have Medicaid planning to do, go to an elder law attorney before October 1st, and preferably go tomorrow or today. Because like I said, October 1st, that's the drop dead date. You either made it or you didn't. Again, my name is Daniel Timins. Thank you, PSS, once again, for your help in helping educate the community.
Thank you, Daniel. Thank you, everyone, for participating. If you have any additional question, can you put your last slide? Or it's there. Okay, so I couldn't see it. So if you have any additional question for Dan, you can please reach out to him. If you have any question regarding caregiver services and you want to ask a question for PSS, please reach out to me. The recording will be posting online in a few days, so we can go back and view any information that you missed. Again, thank you and have a great day, everyone.